This video is for educational purposes only and does not constitute professional medical advice. Please consult with your doctor or a qualified healthcare specialist before starting any new vitamins or supplements mentioned in this video. Use of this information is at your own risk. Imagine waking up one morning and realizing that the floor feels further away than it used to. Imagine reaching for a glass of water and feeling a sudden, sharp betrayal in your leg that makes you stumble. You think it is just a bad hip. You think it is just a normal part of turning 60. You are wrong. What you are actually feeling is the beginning of a catastrophic failure. Your body is effectively being stripped of its armor. Every time you rub that aching joint or reach for a foam roller to soothe your side, you are ignoring a fire that is consuming the very foundation of your movement. This isn't just discomfort. It is the sound of your independence being stolen in the middle of the night. If you don't change your approach immediately, the muscle loss you are experiencing right now will become your new reality. A reality where a simple walk to the mailbox feels like a marathon, and a flight of stairs becomes an insurmountable mountain. We are talking about the loss of the very tissue that allows you to stand tall, to play with your grandchildren, and to live without a walker. The clock is ticking, and every day you spend treating the wrong area is another day you lose a fraction of your strength that you may never get back. Welcome to ElderFit Nutrition. It's a pleasure to have you with us today. We are here because the standard advice you have been given is not just ineffective, it is dangerous. It keeps you focused on the symptom while the root cause, the silent decay of your stabilizer muscles, continues to hollow you out from the inside. We are going to peel back the curtain on why 80% of hip pain isn't about the bone or the joint at all, but about a system that is failing to support itself. Before we go any further, I need you to understand that you have the power to stop this. You have the power to reclaim the strength that is currently slipping through your fingers. But you have to listen closely because the ending of this story depends entirely on what you do in the next few minutes. If you want to stop this decay and rebuild a body that serves you for decades to come, please subscribe to ElderFit Nutrition. Your support allows us to continue bringing these life-changing truths to our community, ensuring that no one has to face the fear of frailty alone. Now, look at your situation honestly. Most people spend thousands of dollars on physical therapy that only focuses on the hip, yet they still can't walk a block without pain. They are losing the battle because they don't see the invisible thief. Are you ready to see what is actually happening beneath the skin? Are you ready to stop being a victim of your own anatomy? Reflective question. Based on what you have heard so far, which of these feels more like your current situation? A. I believe my hip pain is just a natural sign of aging that I have to live with. B. I suspect my hip pain is a warning signal that my body's foundation is failing. Please comment A or B below. I want to see how many of you are ready to face the truth. To save your body, you must first identify the traitors within. It is a biological betrayal that happens in the shadows, far away from the hip joint where you feel the sting. We have identified 3 specific sources that are actively sabotaging your strength and causing your body to compensate until it breaks. The first saboteur is your own spine, specifically the lower back at the L4, L5 DAV, and S1 DAW levels. Think of your spine as the master electrical grid of your entire lower body. When the discs between these vertebrae begin to thin or bulge, a process that accelerates rapidly after 60, they start to pinch the very wires that tell your hip muscles how to fire. This is the ultimate deception. Your brain feels the pain in your hip, but the short circuit is happening in your back. If the signal from the spine is weak, the muscles in your hip will never be strong, no matter how many squats you do. You are essentially trying to turn on a light bulb when the wiring in the wall has been cut. The second saboteur is a muscle so deep and so powerful that it is often called the soul of the human frame, the psoas. This muscle connects your lower spine directly to your thigh bone. In our modern world, we have turned the psoas into a prisoner. By sitting for hours at a time, we keep this muscle in a constant state of contraction. It becomes a tight, angry cable that yanks on your spine and pulls your hip joint out of its natural alignment. When you finally stand up to walk, This shortened muscle refuses to let go. It creates a crushing pressure in your groin and a dull ache in your buttock that most people mistake for arthritis. It isn't arthritis. It is a muscle that has forgotten how to breathe. The third saboteur is the most overlooked of all, the gluteus medius. This is the small muscle on the side of your hip that acts as a stabilizer. Its job is to keep your pelvis level every time you take a step. When this muscle weakens, and it weakens faster than almost any other muscle as we age, your entire structural integrity collapses. Every step you take becomes a moment of instability. Your pelvis drops, your knee caves in, and your hip joint is forced to absorb a level of impact it was never designed to handle. This is the wobble that leads to falls and fractures. It is a silent weakness that forces other muscles to overwork until they too give out in a chain reaction of failure. These three sources create a perfect storm of dysfunction. They work together to ensure that your hip pain remains permanent and your muscles continue to waste away. Until you address the electrical interference in your spine, the tethered grip of your psoas, and the catastrophic weakness of your gluteus medius, you are simply rearranging the deck chairs on a sinking ship. The pain you feel is the alarm bell. These three saboteurs are the fire. Now that you know who they are, we can finally begin the process of extinguishing the flames and rebuilding your power. Now we reach the moment of reckoning, the point where we stop speculating and begin to confront the cold, hard reality of your body's current state. It is easy to hide behind loose clothing or the excuse of a slow day, but these vitality tests will strip away the denial and show you exactly where the decay has taken root. This is not about judgment, it is about survival. If you cannot pass these simple movements, you are living on borrowed time, and the foundation of your mobility is crumbling faster than you realize. I want you to find a quiet space, stand tall if you are able, and prepare to face the truth. The first test targets the silent electrical failure in your spine. Stand with your feet hip-width apart. Place your hand on the exact spot where your hip screams the loudest. Now, slowly, with intention, bend forward at the waist as if reaching for the floor. Do not force it. Simply observe. Does the pain in your hip intensify? Does it send a gyvering shock down your leg? Now, stand back up and gently arch your spine backward, supporting your lower back with your hands. If either of these movements changes the quality of your hip pain, your spine is the culprit. It means your hip problem is actually a spinal breakdown that is slowly paralyzing the signals to your legs. Next, we must expose the invisible tether of the psoas. Find a firm surface, like a bed or a sofa, and lie down on your back. Bring one knee tightly to your chest, holding it there with both hands. Let your other leg hang off the edge of the surface. In a healthy body, that hanging leg should drop toward the floor, heavy and relaxed. If your leg remains stubbornly elevated, or if you feel a tight, gripping tension in the front of your hip, your psoas has become a rigid cable. It is literally yanking your skeleton out of alignment every second of the day, acting as a brake on your every movement. Finally, we test the ultimate stabilizer, the gluteus medius. Stand in front of a mirror and lift one foot off the ground. Balance. Watch your hips closely. If the hip of your lifted leg drops down toward the floor, or if your upper body lurches to the side to keep you from falling, the muscle that is supposed to hold you upright has vanished. This is the Trendelenburg collapse, a clear sign that your stabilizer is TOing, leaving your hip joint to grind against itself without protection. If you felt wobbly, unstable, or weak during any of these tests, the fire is burning. The decay is real. But now that we have diagnosed the damage, we can finally move to the cure. To reverse this downward spiral, we must follow a precise, sacred order of restoration. You cannot simply jump into strengthening a body that is locked in a state of self-protection. To do so is to invite further injury. We begin with the first step, release. We must decompress the spine and the psoas to stop the short circuit and the tethering. Lie on your back on a firm mat. Draw your knees toward your chest with a gentle, sustained pressure. As you exhale, imagine the spaces between your vertebrae opening up, allowing the life-giving signals to flow once more to your legs. Feel the tension in your lower back dissolve. This is not just a stretch, it is an act of liberation for your nervous system. Once the tension is released, we move to the second step, Activate. We must go into the dormant territories of your glutes and wake up the fibers that have forgotten how to work. Lying on your side, perform a controlled leg lift, leading with your heel and keeping your hips stacked. You may feel a burn. That is the sensation of a muscle returning from the dead. We then move into a modified lunge, focusing on a posterior pelvic tilt to specifically target the psoas in a lengthened position. We are teaching your muscles that it is safe to be strong again. We are feeding the muscle tissue with blood flow and purpose, forcing the atrophy to retreat. The final and most vital step is integration. We must teach your body to function as a unified, powerful system. Once more, this is achieved through functional balance. Stand on one leg near a wall for safety, but try not to touch it. Engage your core, level your pelvis, and breathe. This forces the gluteus medius, the psoas, and the spinal stabilizers to communicate in real time. You are recalibrating your internal GPS. You are telling your brain that you are still capable, still stable, and still in control. This three-step sequence is the bridge between a future of frailty and a life of vibrant, independent movement. It takes less than 10 minutes, but it provides the structural integrity that your body has been starving for. Do not skip a step. Do not rush the process. Your muscles are waiting for your command. This is your contract with yourself, a 14-day commitment to stand against the tide of time and reclaim the territory you have lost to pain and inactivity. For the next 2 weeks, I am asking for just 8 minutes of your morning. 8 minutes before you have your coffee, before you check the news, and before you allow the world to dictate how you feel. This is the critical window where you decide if you will be the master of your movement or a servant to your symptoms. Every morning, you perform this sequence. You are sending a clear, undeniable signal to your nervous system that you are not ready to surrender. You are feeding the very fibers that have begun to waste away. And you are recalibrating the internal sensors that have been screaming in false alarm. I want you to track this journey with precision because your progress is the ultimate proof of your power. On a scale of 1 to 10, record where your pain and stiffness sit today. Check that number again after 7 days, and finally after 14. Do not look for perfection. Look for the subtle shift from a jagged ache to a dull hum or the newfound stability in your step. After these initial 2 weeks of daily reconstruction, you can transition to a maintenance phase of 3 to 4 times a week, but never allow yourself to slide back into the sedentary habits that invited the decay in the first place. This routine is your new baseline for a life lived in motion. However, true wisdom lies in knowing when the battle requires reinforcements. If you commit to this sequence with absolute consistency for 3 weeks and see zero improvement, or if your pain is accompanied by night sweats, unexplained weight loss, or a total loss of sensation, you must seek professional intervention. There are structural realities, labral tears, severe arthritis, or advanced disc pathology that require the eye of a specialist. But for the vast majority of you, this path of release, activation, and integration will be the turning point. This is the moment you stop being a patient and start being a practitioner of your own health. The journey we have taken today is more than just a guide to physical exercise. It is a total paradigm shift in how we perceive the aging process. We have been conditioned to believe that the onset of 60 marks an inevitable decline, a slow, painful fading of our physical capabilities. We are told that wear and tear is an inescapable debt we must pay for the years we have lived. But as we have uncovered, much of what we label as aging is actually disuse and miscommunication. Your hip pain was never just a localized failure of a joint. It was a symptom of a system that had lost its harmony. By looking away from the site of the pain and toward the source of the dysfunction, you have begun to speak the true language of your body. The profound lesson here is that your body is not a static machine that simply wears out like a set of old tires. Instead, it is a living, adaptive organism that responds to the demands you place upon it. When you sit for hours, your psoas adapts to being short. When you stop challenging your balance, your gluteus medius adapts to being weak. Pain is not a punishment for getting older. It is a highly sophisticated communication tool designed to tell you that your current way of moving is no longer sustainable. To apply this to your life, you must adopt the philosophy of constant maintenance. You do not brush your teeth once and expect them to be clean forever. Similarly, you cannot fix your body once and expect it to stay resilient without daily attention. The application of this truth goes beyond these 8 minutes. It means changing how you sit, how you stand, and how you view every movement throughout your day. It means choosing the stairs over the elevator, not just for the cardio, but to keep your stabilizers awake. It means recognizing that every moment of movement is an investment in your future independence. You are building a fortress of muscle and bone that will carry you through your 70s, 80s, and beyond. This is the ultimate form of self-respect, to tend to the vessel that allows you to experience the world. You are not just fixing a hip, you are preserving a soul. What was the most surprising thing you learned today? The role of your lower back, the sole muscle psoas, or the weakness of your glutes? Please comment your thoughts below so we can all learn from each other's experiences. And don't forget to subscribe to ElderFit Nutrition to support us in creating more life-changing content for you.